You're listening to the Martin Clinic Wellness Podcast. This is the show where we bring you the best tips, tricks, and nutritional hacks to help you and your family get healthier. You will also hear what works and doesn't work so you don't have to waste your time and money. All right, let's get started. Hello, my name is Dr. Tony Martin Jr. of the Martin Clinic, and I'm here with my dad, Dr. Tony Martin Sr. of the Martin Clinic. And today we want to talk about a video that was put online by the American Diabetes Association that actually is creating quite a bit of a public backlash against them. Now, if you're not familiar with the video, the American Diabetes Association right now is doing something, and I'm just going on their website as we're here. They're doing something called the America's Diabetes Challenge. And the idea behind that is to get to your goals, right? So they put out this big challenge. Like I said, they've registered the name. It's America's Diabetes Challenge. And, of course, one of the sponsors of it, front and center, is Merck. And we'll talk about that in a second. But what they did is if you go on the American Diabetes Association website or go to AmericanDiabetesChallenge.com, you'll see they throw up a bunch of healthy eating, diabetes-friendly recipes. And what they did earlier this week, and again, if you're listening to this, this is recorded in October, they put out a video of a recipe. And if you get a chance, go look it up and then read the comment section because, it's hilarious. The comments, what people are saying, it's literally talking about lawsuits and it's stupid. And just give you an idea of the ingredients that they throw in there. At the end of the day, I did some rough math and figured out in a bowl of this stuff, it's like a rice
pudding, isn't it?
Yeah, like a rice pudding. Yeah. And per bowl...
No diabetic in the universe should ever have a rice pudding.
No. And we'll talk about that because that's just...
Just to start off with,
yeah,
it would be wrong.
So right? they put this video up on how to make this dessert, this diabetes-friendly dessert. And based on rough math, there's in the bowl that they made, there are about 355 grams of carbs in a bowl. In the bowl that they made. Now, that might be 2 servings, but okay, cut that in half. I mean, that is a... really, and a lot of people are commenting on that, which is funny, which is the America's Diabetes Challenge. Basically, they're challenging you to get diabetes, right? It's like they're telling you how to get that. I thought it was a joke when it came across my news feed. I honestly thought it was a joke. I thought it was like The Onion or something that was making a parody of these healthy, quote unquote, videos and making a joke, kind of like the one we've laughed at before, where the guy talks about, like being a vegan and, or talking about, the other guys, eating meat with everything. And he also makes the gluten ones and it's very funny, yeah. But it's a parody, right? It's a very fun. I honestly thought watching this that it was a parody. And at the end, it would be
they're dead serious.
No, it's literally put out by the American Diabetes Association.
But really, when you think about it, the sponsor, Merck, right?
Yeah. And
who makes a huge, huge killing on diabetic medication.
Yeah, they're the makers of Januvia, right?
Yeah.
Which is that big diabetes drug.
Yeah. And
if you go, and the funny thing is, if you go to their website, they market at Januvia.com, and you look at their website, right front and center, it says their marketing slogan is this. And if you go there, you'll see it. It starts off. It says, first of all, it treats works with high blood sugar levels. That's what it's for. It's a drug to lower blood sugar. Well, first and foremost, they're sponsoring a challenge where a video goes out that if you are diabetic and you eat that dessert, you will need
lots of Januvia,
lots of drugs just to bring your blood sugar levels down, and so, when I saw that video, I honestly thought it was a joke. I thought it was a parody. It had to be. There's no way on earth that in 2016, the American Diabetes Association puts out a diabetes-friendly recipe that is literally loaded. And right in the ingredients itself, in the bowl, part of the ingredients is 2 tablespoons of sugar in a bowl. And then they got a full cup of condensed milk. And I can't find unsweetened anywhere. I looked them up. a couple hundred grams of carbs, and it even said sweetened. So if anybody wanted to even substitute it, it's utterly ridiculous. In fact, it goes beyond that, right? It goes beyond just stupidity. It is actually very dangerous. I mean, it's actually, that's a dangerous thing to put out there. Now, if you're, subscriber to our newsletters, we talked about this in the new year over Christmas. We had seen a post by the American Diabetes Association as well. They got a great track record where the head of their science or their, one of their departments in one of the magazines said, hey, listen, if you're going to eat a banana or a brownie, it doesn't matter. They're both carbs, just whatever. Right. And it was, you're thinking, really? I mean, that's idiotic. That's bad advice, right? Mm-hmm. Like a brownie and a banana in her head, because they're both carbs, are in the same boat, which is, again, stupid. And we should mention this, is we're not anti-carbs. People think that. We're not. We're anti-fake foods in a sense, right? Because the carbs, when we talk about carbs, we're not talking about fruit, even though if you are diabetic, fruit is no good for you. People are always surprised to hear that.
Well, they're God's candies, right? You got to have very few of them.
Yeah, and
as a diabetic.
If you're diabetic, your metabolism, you're allergic to, and we tell people all this all the time, right? If you have an allergy to peanuts, you stay away from peanuts. If you have an allergy to gluten, you stay away from gluten. If you're type 2 diabetic or you got metabolic syndrome, you got an allergy to carbohydrates. Yeah. You can't process them properly.
But it shows you, though, okay? And it's our big beef. When you look at, and they're not alone, but the American Diabetic Association, all their emphasis, they talk about, it actually says it right there, looking for a cure, but they're looking for a drug.
Well, they don't want a cure. The worst thing that can happen to them is diabetes. I mean, diabetes is a gold mine, and it's only going to get worse. Wow. I mean, it is an ever-expanding market for them. The last thing that they want to have happen is it to be cured, because, I mean, it is the future of their companies. Diabetes treatment, and again, they don't even use the word treatment. They use the word management, right? Yeah. Because if you go right on the websites of like the American Diabetes Association, you'll read that diabetes is a chronic progressive disease, meaning you're going to have it forever and it's only going to get worse, so deal with it.
Yeah, and we're going to help you manage it.
Basically, if you undergo their recommended treatment protocols, yes, diabetes will be a chronic progressive disease that only gets worse. That's why amputations are up in every country, every modern country, that people are having to imagine. Amputations, I was reading an article in Australia, are up like 25% already, like this year. Because again, that's end stage diabetes. That's what's happening.
There's never a good result if you're a diabetic. At the end, there's no good result. No. It's just never good, because you're much more susceptible to everything from cancer, cardiovascular, stroke. I mean, diabetes will kill you.
And most people don't realize this, but aging, really, what happens when we age is our organs become more insulin resistant. So as we age, our cells become more and more insulin resistant.
And that's why Alzheimer's is called type 3 diabetes, right?
So a diabetic has sped up that aging process in their cells, right? So yeah, it doesn't end well for them. And unfortunately, another thing that came out in the last, 2 weeks, which is also very interesting, is that every year these big food companies, soda companies, they get caught with their hand in the cookie jar, in a sense, is they get caught paying dietitians, for example. A whole list of dietitians got caught getting money from Coke or Pepsi to tweet on behalf of, against the sugar tax that they were talking against the sugar tax. Essentially, it was a great article that was done, and it was based off of a study that was also done showing how they influence public health. And what I have here in front of me is it was something that was recently published in the American, it was published in the American Journal of Preventative Medicine. And what they did is this is the name of the article. It's sponsorship of national health organizations by 2 major soda companies. So what they did is they wanted to see where their money was going, and they looked at Coke and Pepsi by themselves. And I'll just read you some of the names of the lists that are receiving a fair amount of money from Coke or Pepsi. And you cannot tell me that this does not influence public health decisions, right? Yeah. First of all, here we go, Feeding America. But I'll go through some of the big ones. The American Cancer Society.
Imagine Coke and
Pepsi. And they would say we're doing it to give them the money for research, but are you kidding? They're doing it so that that no negative comes out. They don't want the American Cancer Society saying stay away from sugar, which is why over Christmas here in Sudbury, you had a dietitian basically putting out a thing on Facebook saying that sugar does not cause cancer or sugar does not make cancer. You know, they were mocking it, saying sugar does not feed cancer. They were mocking it. With the funny thing is, but by the end of the same week that they put that out, a major study came out showing that cancer does feed sugar. So it was it's just like you couldn't have asked for worse timing. Yeah. But that's what it is. So, right? So here we have, again, here we are in cancer, Breast Cancer Awareness Month. Sugar, we're going to do this a podcast on that coming up, has been, again, shown to increase obesity, and obesity increases the risk of breast cancer, right? But anyways.
Big time.
So they're giving money to the American Cancer Society here, the American Diabetes Association. So, they're giving money to this Diabetes Association. Real shame. Here's a couple more. Again, Juvenile Diabetes Research Foundation, right? National Breast Cancer Foundation. And this is where they really start to influence public health. They've given money to the Center for Disease Control, the CDC. The National Institute of Health, the NIH, which are major influences in public health policy. Yeah. So here you have the CDC and the National Institute of Health taking money from a major...
Do you think they will ever not write against it?
It's criminal. Yeah. That's criminal, right? Here we go. Let's go on. National Heart and Lung and Blood Institute. Here you have the American Academy of Family Physicians. Why in the world is Coke and Pepsi giving money to the American Academy of Family Physicians? And they're the ones that are frontline defense for diabetes. The person goes in, they're right? It's unbelievable. Here we go. American Academy of Pediatrics, American College of Cardiology, American College of Sports Medicine. And by the way, another interesting podcast would be on the effect that insulin resistance has on joint pain, because orthopedic surgeons are seeing a lot more knee replacements than ever before. And I guarantee you it's because of insulin resistance, because there are studies showing that. But we'll talk about that another time. But here they're giving it to the American College of Sport, the American Lung Association, the American Medical Association, the American Red Cross. We can go on and on. Institute of Medicine, Preventative Cardiovascular Nurses Association, the Pink Ribbon Story Foundation, National Dental Association. The dentist shouldn't take a penny from them.
Imagine.
Thanks, but no thanks. The National Dental Association, sugar causes every issue that they see in a dental office, and they're taking money from Coke and Pepsi.
It's unbelievable.
Well, I should probably clarify, because let me just see who they're actually taking the money from. Coca-Cola, not Pepsi. So I don't want to blame Pepsi for that one. Anyways, it goes on. The American Society for Nutrition. Joke. You're a nutrition society and you're taking money from Coke and Pepsi. Are you kidding me? You're taking money from them? Anyways, like I said, the list is, you're seeing me scroll through the list. It's unbelievable. Who they're influencing with their money. The International Food Information Council, National Coalition for Women and Heart Disease, National Foundation for Governors Fitness Councils. You don't think they're influencing public health policies? Right down to the kids level in school? Their money is being strategically given out at every level. It's unbelievable. They're sponsoring the National Physical Activity Plan, because again, you got to remember their motto is, listen, it could be part of, as long as you're moving more, it could be part of a balance.
You can still have a Pepsi Coke. Or a Coke a day, right?
Yeah. That's the message that they're they're sending out.
Keep moving. That's all right. You're burning it off.
Anyways.
Insanity.
Yeah, it is. It's very frustrating, right? So this is what's going on. So the messages that you see out there, the advertisings that you see out there, are all being influenced heavily by dollars make no mistake. To think otherwise would be absolutely naive. They're not giving the money out just for the sake of giving money out.
Follow the money.
They're influencing policy and opinions from a young age. I mean, it is. Even like, for example, around here, they took out a lot of the pop vending machines. But again, they still sell Gatorade, which is made by the same company, right? Pepsi. They're still selling. They're selling.
Now you're getting electrolytes. It's good for you.
Yeah.
Right?
It's just they still got their fingers in the school,
just another
right?
pile of sugar like anything else, right?
Yeah. So it is. It's a very. Now let's briefly, this podcast has been more of a rant than anything else, because when we saw that video, we were just so shocked. That
it still shocks me in the office. And it happens too frequently, but it's just, I guess, because my senses, I always tell patients, look, if you do nothing else when you leave here, if you do nothing else, you didn't learn anything else, cut sugar out of your diet as much as you can, right? If you go home and just do that for your health, you've done yourself a big favor. So I'm very big on that. But it always shocks me how many people come in still today and they tell me that, oh, you know what? My habit is I drink soda. Like I drink Pepsi or I drink a Coke. I drink Pepsi every day or drink Coke every day. What? In 2016, you still have a soft drink every day? I guess, but when you see what Pepsi and Coke does,
yeah, I mean,
to keep their sales up. You know what I mean? Like you can, like for me, I mean, I'm so opposite of that.
Well, the worst thing you can do is drink your sugar. I mean, sugar is bad. Sugar, sugar is a empty nutrient. There's nothing in it. There's no value to sugar whatsoever. I mean, if you never had,
it's so toxic.
Yeah,
we talked about that, right?
Yeah, your blood. Glucose is toxic to your body, which is why it's so tightly regulated.
Yeah.
Everything
in your body works to regulate your glucose.
You don't need it.
Your blood.
You don't need it. You need so little of it that your body does whatever it can to get it out of the bloodstream as fast as it can. It shoves it in the muscle. There's only so much space in there, so then it shoves it in your liver. Even the liver gets, people get fatty liver disease, and then
stuff.
Shoves them in fat cells. It's incredible, right? Glucose is toxic to the body, which is why high blood sugar is dangerous, which is why your body works very hard to get rid of it, which is why, again, like you said, if anything, just cut out sugar. And then stage 2 would be cut out soon-to-be sugars like bread, right? Those things are quickly bread, if you're, again, we'll talk about this in a second, but bread for a diabetic is just like, we get this question all the time, even on the radio. People are like, my blood sugars are high in the morning. Okay, let's go. What are you eating in the morning? Well, I'm having wheat toast.
Yeah, but it's whole wheat.
It's whole wheat, right? Yeah, but goes by fat. Like studies have shown, those are major release of insulin after. Yeah, it's going to mess everything up for sure. I mean, no question, right? Now, if we're talking about this, we have to talk about a new study that was done that most people haven't heard about, which is amazing to think about because it is, it was fairly big news in terms of. I'll read you the title here. It was a study that was published by the Journal of Nutrition and Diabetes. And what they did is they looked at the short-term safety, tolerability, and efficacy of a very low-calorie ketogenic diet versus the traditional advice that's out there right now, which is a low-fat diet. So they compared a low-carb to a low-fat diet for diabetics, specifically type 2 diabetics, and they wanted to see. And again, this thing was published in September of 2016, so it's not that old. And what's interesting...
Surprise on the results?
Yeah, not at all. I mean, that's right. And this is what they concluded in their... Here, I'll just read you the conclusion. The interventional weight loss program based on a very low carb diet is most effective, not more effective, is most effective in reducing body weight and improvement of glycemic control than standard hypocaloric diet. And it says here, with safety and good tolerance for type 2 diabetes patients.
So very safe, very good for them.
And it's most effective.
Hello?
Yes.
How long have we been saying that?
Because as a rule of thumb, a diabetic, when they get on a low-fat diet, it ends up being a high-carb diet. And we can't stress this enough. Yeah. Well, first of all, let me rant on this for a few seconds. High blood sugar is a symptom of diabetes, not the cause. You're not a diabetic because you have high blood sugar. You have high blood sugar because you have diabetes. Yeah. And the current treatment or management approach is all about maintaining blood sugar at a certain level. Drugs, that's all they do. They lower your blood sugar. Again, they're treating a symptom. Imagine having an infection, right? Imagine I heard a doctor talk about this. You get a cut, it gets infected, and your whole body becomes septic. And all they're doing is they're putting a Band-Aid on the actual cut on your leg that caused the whole thing without treating that's what they're doing. They're treating the symptom, not the cause. Because the cause of type 2 diabetes is a disease of insulin.
Yep.
Hyperinsulinemia.
Severe insulin resistance. So that you have to eat and do things to control insulin. That's how you put diabetes into remission, type 2 diabetes into remission, is by fixing the insulin. And you do that by eating low insulinogenic foods. And if you're not sure what those are, go back a couple of podcasts. Just go to our website, martinclinic.com, and listen to, we have a couple of podcasts on what those foods are and what foods you should be avoiding, ones that throw your... But we said this earlier, and we're going to end with this. If you are a type 2 diabetic, or, you are pre-diabetic, which, again, if you have high blood pressure, you're pre-diabetic. If you have metabolic syndrome is stage 1 diabetes. You're diabetic. People come and say, well, I got metabolic syndrome. I don't have diabetes yet. No, you have undiagnosed diabetes. You're diabetic. Yeah, because your insulin is skyrocketing. Yeah. You have insulin resistance out the wazoo.
Yeah, we're just splitting names on the name. Yeah. We're just discussing nomenclature at this point. Physiologically, your body is behaving very much, again, because they're only looking at blood sugar because the diagnosis is based off blood sugar, but their insulin levels and everything else.
And who made up the number, right? Like, even when you think of it, like for one person.
Yeah, if you're if all of a sudden, if you're like one digit below, you're okay. Oh, it's high. You got normal high. They call it normal high. Anyways,
there's no such thing as normal high.
Yeah, it's so frustrating. Anyway, so this whole thing started with a video that got us quite worked up when we were talking about this video. So, anyways, we want to thank you for listening to this little rant of a podcast today. If you have any questions at all, we would encourage you to either email us at info@martinclinic.com. We also want, if you listen to our podcast and you haven't left us a review on iTunes, we'd really appreciate if you would leave us an honest review there. That really helps our podcast deliverability with iTunes, so we appreciate that. And again, if you are not subscribers of our newsletters, we talk about a lot of these things in our newsletters, then I would encourage you to do that. You can do that by just going to martinclinic.com. And also be sure to check us out on Facebook, because we do have Facebook Live pretty much every Thursday, where we answer your questions just right then and there. So, and we really enjoy that, and we're getting some good feedback. So again, we want to definitely thank you for listening, and we'll see you again next week. You've been listening to the Martin Clinic Wellness Podcast, brought to you by martinclinic.com. We are truly thankful that you took the time out of your busy day to listen. Talk soon.